Welcome to another episode of Med Madness, your go-to podcast for mastering medical knowledge. Today we're delving into neonatal displaced clavicular fractures, an important topic for all medical students and professionals. Understanding this condition is crucial because it frequently occurs due to difficult deliveries and can present challenges in neonatal care. In this episode, we'll cover everything from the basics of the condition to its management and treatment, ensuring you're well prepared for both exams and real-world practice. Next, let's discuss what this condition is. A neonatal displaced clavicular fracture is a break in the collarbone of a newborn, typically occurring due to the mechanical stresses of childbirth. This condition often arises from difficult deliveries, where factors such as fetal macrosomia, maternal diabetes, mellitus, post-term pregnancy, instrumental deliveries using vacuum or forceps, and shoulder dystocia increase the risk. The pathophysiology involves excessive pressure on the clavicle during delivery, leading to a fracture that can cause significant distress in newborns. Now let's move on to the symptoms and clinical presentation. Clinically, a newborn with a displaced clavicular fracture may exhibit crying or pain with passive motion of the affected arm. Crepitus, or a crackling sensation over the clavicle, can often be felt, and there may be an asymmetric Moro reflex where the baby's startle response is uneven. These signs are crucial for early identification and prompt management to alleviate discomfort and prevent complications. Next, let's discuss how to diagnose this condition. Diagnosing a neonatal clavicular fracture typically involves a thorough physical examination, followed by imaging. An X-ray is the primary diagnostic tool, providing clear evidence of the fracture and helping to confirm the diagnosis. Early detection through careful screening and clinical assessment is essential for effective management. Moving on, let's discuss the management and treatment options. Treatment for a neonatal displaced clavicular fracture is usually conservative. Parental reassurance is paramount, as these fractures often heal rapidly, within 7-10 days, without long-term sequelae. Gentle handling of the infant is advised to minimize discomfort. Analgesics like acetaminophen can be used for pain relief, while aspirin is generally avoided due to the risk of Reye syndrome. Immobilization of the affected arm by placing it in a long-sleeved garment and pinning the sleeve to the chest with the elbow flexed at 90 degrees can help reduce movement and pain. Now, let's consider a case study to illustrate this condition. A newborn, delivered via vacuum extraction, presented with noticeable crying when the left arm was moved. Upon examination, crepitus was felt over the clavicle, and the Moro reflex was asymmetric. An X-ray confirmed a displaced clavicular fracture. The treatment involved reassuring the parents, advising gentle handling, and administering acetaminophen for pain. The infant's arm was immobilized as described, and follow-up showed complete healing within a week, with no complications. In summary, neonatal displaced clavicular fractures, while often associated with difficult deliveries, can be effectively managed with early diagnosis and appropriate care. Understanding the risk factors, clinical presentation, and management strategies is crucial for any medical professional dealing with neonatal care. Remember, early diagnosis and intervention are key to preventing complications and ensuring rapid recovery. Don't forget to engage with our pre- and post-podcast quizzes and use the Anki flashcards to reinforce your learning. Thank you for listening to Med Madness and stay tuned for more insightful episodes.